that has taken the time out of their busy schedule to come and celebrate the success that we had in terms of getting a PCHS accredited. A number of people played a very prominent role. Some of our organizations, some of our partners helped us tremendously in this journey of last 16 months. When we first had an idea that we're going to get PCHS accredited, and from all the way up to getting the day, I remember it was June 14, 15, 16 or 12, 12, 13, 14. June. So, it was amazing to see that the whole staff was on that particular day. I wish that I had the video to see how staff was so determined to get accredited. They were helping each other, they were talking to each other, and I remember that we forgot one document on that particular day. So the staff, myself and Amandeep, we were here till 12 midnight trying to get that document together, because that's what CARF had wanted, that we should get the document. And I think it's more than celebration, is the absolute commitment that the PCHS staff and the volunteers showed in terms of rising up to the occasion. So while they were completing their day-to-day tasks of seeing the clients, none of the services were disrupted. At the same time, they rose up to the occasion of doing that extra work that is required. So from policy development, coming up with models, coming up with evaluations, looking at it, and then going back and changing the entire thing because this particular evaluation didn't meet this particular standard. So it was quite a learning experience, and in that process, and one thing I can demonstrably say, that not only just the staff has learned a lot, but we as an organization have learned a lot. What does it mean to provide services that are based on certain best practices? So when a client comes in, when a phone call comes in at the intake, to all the way when the client is satisfied and walks out, we can reasonably make sure now that nobody falls through the cracks. And I think that is what accreditation does to an organization. Is it an enormous amount of work? Yes. Does it cost quite a bit in terms of bringing in a consultant, working hard, getting the practices done? Yes, it does. But in the end of the day, if the organization is committed to provide credible, efficient, effective services to the clients, I think then we need to get accredited. And to that extent, my sincere thanks to all the staff, and especially thanks to all our board members. And especially the board was really stressed out, as these are volunteers who devote X number of hours every month, and they come here, and then you put papers in front of them to pass policies which they haven't had the time to read properly. And I think those are some of the things that when they rise up to the occasion and say, okay, this is how we are going to get accredited. And really thanks to our board members as well for supporting us through this journey of accreditation. And I would also like to thank our partners. We have wonderful support that I could pick up as the CEO, talk to people. We talked to Keynes, we talked to CMHAPO, we talked to Monty at Caledon Community Services, we talked to Ray, who's been in the system for a long time, took his advice. and many other organizations whom we could rely and count on for extra help and suggestions. I know that many times I called Gurvinder at William Osler and I said, look, we are stuck here, what can we do? So not only just in terms of the policies, but also in terms of how do we move certain things forward. So I really would like to thank all our partners in terms of they supporting us, because without their support we would not be here. It's just absolutely not possible without that partnership. And then we would also like to thank our volunteers who were here to support us, and some of the volunteers continue to come every day with us, and they devote enormous amount of time. And where is Gaya? Gaya is here somewhere she is hiding. She is one of our volunteers who comes 5 days a week, sometimes 6 days a week, and if we have an event on Sundays, she also comes on Sundays as well. And she helped us out enormously. She works in the seniors program, and now she can also, she speaks Tamil and some of the other South Asian languages. Now she can also speak Punjabi as well. So our seniors have also taught her. So I would like, in order for us to celebrate, I would like David Colgan, who is the Senior Director at Central Wesley, to please come forward. They have always supported us, not just financially, but financially, without their financial support we wouldn't be here, but also some moral support. And they have also encouraged us. And I still remember David when the first time he gave us money was in April 1st, 2008. He said, do you know, Baldev, that this money comes with a lot of reporting? And I said, yeah, I'm used to. I used to work for Peel Health Department as a community development officer. I know reporting. He says, no, it comes with a lot of reporting. I said, yes, I have done a lot of reports. He said, no, you don't understand. It's a lot of reporting. Now I know what he meant by lot of reporting. Yes. David, please come and say a few words.
Thank you. We've known Punjabi Community Services, or I've known Punjabi Community Services since 2006, and that's when the LINs were put in place. And at that time, we met Baldev, and at that time, some of us, I lived in Brampton for 30 years, didn't quite know how to connect. And Baldev was there to help teach us. And Samina Talat, who used to work with us, there she is, was someone else who helped us start to connect. And I was just saying, the issue is, for the LIN, it's pretty straightforward, and in part, Baldev's taught us some lessons, and in part, it's pretty obvious. If you're going to serve the community, you have to serve the residents of the community. Who are the residents of the community that you're serving? It's pretty obvious. You've got to connect to the folks that you're serving. And Baldev's done a great job in teaching us not only that lesson, but how to do that. So we're very proud of Punjabi Community Health Services. It's, in the province of Ontario, it was the first, when the LINs came into place, the first organization that was turned into a health service provider. What that means, it's the first organization that wasn't already receiving money from the Ministry of Health and Long-Term Care, that the LINs, cross-province first one, the LINs said, you will become a health service provider. We will give you funding, we will give you an accountability agreement, and we will give you this stack of paper to start to report back about what you're doing. So that was a big step, and we've really enjoyed the development of that relationship. And once again, Baldev's a little bit ahead of us, because we've just completed our integrated health services plan, our plan for the next 3 years, and in that plan, we have decided that we're going to look for every organization that we fund to be an accredited organization. So, just as Baldev went to other organizations to help them, Baldev, you should expect phone calls from organizations that are not accredited to come to you and ask you for your advice. And that's going to happen too. So this is a big step. I really enjoyed being here today. Thank you very much. Great job. Well, great job, Punjabi Community Health Services, the board, the staff, the volunteers, everyone connected. Good for you. Congratulations.
Thank you. I would like all the representatives of organizations might please come. Sundar, Titi, Nasser, please come. Shilpa, please. From CCAC we have someone? Yeah. Oh, okay. So please come. Yeah, Samina, please come. David is gonna come here as well. Please, please. Anybody else from an umbrella family, please come. Yeah, please. Family. Anybody else from an organization? Come, please. Oh, Yvonne, please come. Yvonne, please come. Yes, please. Who is hiding? Who is hiding at the back? Stephanie, please, Stephanie, come. Come. Okay.
Thank you.